Well, good evening.
Good evening.
It's a pleasure to be here. I've been involved with this organization since 2006, and on one level or another, and it really is an honor to present the John Geyman Award tonight. It's the John Geyman Human Justice Advocate Award. And this organization has, for many years, been an advocate on many, many levels, but we chose as our leader someone who was a retired public school teacher to do it for us. He's been on the board since 2007, been the president since 2011. I met with him several times. He goes back to Washington, D.C. and comes and meets me, and I've also seen him here in my office. His colleagues in the Healthcare for All have told me what an outstanding job he's done. They describe him as a tireless organizer. He crisscrossed the state with meetings with small groups of small single-payer supporters to build the healthcare organization. He's helped mobilize large numbers on short notice last year to attend a legislative hearing on the Health Security Act down in Olympia. He's represented our state in a one-payer alliance or single-payer alliance of 20 states that exist in the United States. Let me just quote one thing from Dr. Sherry Weinberg, who's a longtime healthcare advocate, who said, quote, "Chuck's organizing skills are the glue that is holding the HCFA-WA together. He runs board meetings really well and sets an example that I am trying to follow. I am sure you well know it's hard to maintain enthusiasm and activism over so many years with so little to show for it. I think there are many of us who would long since have thrown in the towel if it weren't for Chuck continuing to ask us to do specific tasks." Chuck Richards, come up here. We may have kept him, we tried to keep him unaware that he was going to get this. So I think we succeeded.
Thank you, sir. Thank you very much.
Thank you. You may say? You may say at least thank you.
I think I'm speechless. Thank you so much. It is so amazing for all of us working together. You all are just amazing. Thank you so much.
It's nice to surprise someone who doesn't go around thinking he deserves to be honored and give him an honor. So it's really a great pleasure to have had the opportunity to do this. Let me just say a couple words about single payer. I would second everything that the previous speaker said. And I want to just sort of outline where I think we are as very quickly, and we'll get to it in the discussion later. I wrote H.R. 1200 back in 1991. Now, first of all, this healthcare reform business is not for the weak of heart or for those who want to live in a 24/7 world where everything is like this, like on your iPhone. This is something where you have to understand you are in a long, grinding battle. I had a meeting in this room in 1993 with Brock Adams, and our goal was to get a metro to the airport. It took us almost 20 years to get it. That's the nature of what you're doing here with healthcare. Winston Churchill once said, you can count on the Americans to do the right thing, but only after they've tried everything else. And we are presently in the trying everything else phase. And I think you should understand that. Those of us who backed the ACA was the best we could get. We got ourselves on the beach at Normandy, and we've been fighting the Huns who have been trying to drive us back into the sea ever since. 52 times, I guess, we've had repealed measures in the House of Representatives. It hasn't stopped. And there's no reason to believe, actually, in my view, that it is going to stop between now and the 2016 election. I expect the next 2 years for it to be perhaps more of the same, because they do not want this entitlement for all Americans, this right for all Americans to become a reality. And that is, they are absolutely dug in, and they're continuing to go at us. There are all kinds of things that should be done to make this thing work better. But I sit on the committee. I'm the ranking member, the ranking Democrat on the Health Subcommittee, the Ways and Means Committee, and we haven't had a single hearing on anything substantive the whole time. Not a single one. Not something we were going to fix to make it better. Always, how can we undermine it? How can we destroy it? How can we weaken it? That's only kind of hearings we've had. Just take one example. If you're somebody in this state and you go on to Medicaid for the first time, that's because your income is down here, right? And you're eligible for Medicaid. Suppose your income sometime during the year goes up. Well, then you go off Medicaid, right? Because you go month by month by month in Medicaid. So if your job holds up, that's fine. Now you go to the exchange and get yourself a plan, and then your income drops again, and you're eligible for Medicaid again. And people are going to be in this kind of situation. It's predictable. No, you don't have to be a magician or a great economist or anything else to be able to see that that's what's out there. Now, I believed in when I wrote this bill in '92, that Tommy Douglas was right in Canada. If you understand Canada, Canada started in Saskatchewan. There were a bunch of farmers who had no money, and he was the prime minister, and he said, hey, look, all of us are so poor, we might as well throw all our money in together and take care of each other. That's how it started. It spread to British Columbia a little later. The doctors saw that it was working, and they thought maybe it would work there. And over time, it spread across Canada, and only at the end, 1967 or 68, they passed a bill that sort of tied it all together. It didn't start all in the capital, in Ottawa. It started in one province and spread to others. And you are seeing that in what's going on in Vermont. You've seen us try several times in this state to make it happen. You've seen people try to make it happen in California. And it is ultimately, in my view, going to happen one state at a time and everybody else. I truly believe that this business about governors turning down Medicaid is going to go in the wastebasket before the election, because Sally in California, who didn't have health insurance and got on Medicaid and has now had her knee replaced, is going to write a letter to her sister Bertha, who lives in Tennessee, and say, Bertha, guess what? We got health care and I got a new knee. My husband and I went out dancing. And Bertha's going to say to her husband, George, why don't we have that kind of health care here in Tennessee? And George is going to say, well, our governor doesn't believe that's good for people to have health insurance from the government. That isn't going to last very long. That's going to go down the tubes as time proceeds. But I believe that the biggest issue that this group should be thinking about right now is the 2015 session of the legislature in Olympia. Because if it's going to happen state by state, there's some stuff you got to get done down there. And you've heard that there is the possibility that state by state it can be done, and they're doing it already in Vermont. They're starting, and there are other places where it's beginning to percolate. And we couldn't even get a study in the last legislature. Now that means we got some work to do with members of the legislature, and they're up running for camp. You all got your ballot. You got my name on it, I'm sure. Yeah. And if I could make now I won't bother, but you should be looking at the people who are running and asking them about whether or not they would support moving forward on this issue. That ought to be something you go en masse and bug them about. And it really can happen, and I think that it is something that is really well within our reach, because when the people understand that the natives are getting restless, there's going to be some change. And I think that by 2017, we can be ready to actually do one. There's some things we need to do in Congress, and we'll talk about it in the discussion in the roundtable. Thank you very much.